Welcome to Raaonline. I am Dr. E. Mohanapriya. Today we are going to see a lecture on popliteal fossa. In CBME based curriculum, this is a competency given in relation to the popliteal fossa. Describe the boundaries, roof, floor, contents and relations of popliteal fossa. Let's start the discussion with the clinical case scenario. A 67-year-old man was noted to have a mass at the back of the knee. The mass was measured approximately 4 cm in transverse diameter. Further clinical examination revealed that this mass was pulsatile and demonstrated a bruit. Bruit is nothing but the audible rumbling sound made by a turbulent blood flow on auscultation. What is a probable diagnosis? And name the vessel involved in this condition. Mention the relation of this involved vessel. The answers for these questions we will see at the end of this lecture. So now coming to the popliteal fossa, in Greek the poplis meaning it is the back of knee. This fossa is diamond or rhomboid shape, hollow, which is present at the back of the, this is the back of the knee joint. This hollow is formed between the muscles of posterior compartment of thigh in the upper part and the muscles of posterior compartment of leg in the lower part. This fossa provides passage of main vessels and nerves from thigh to the leg region. The popliteal fossa is described under the following subheadings. It has roof, boundaries, contents and floor. Since the popliteal fossa is present in the back of the knee joint, the roof is also called as posterior wall. So in this first picture, you can see the roof of the popliteal fossa. Here the skin and superficial fascia was removed and you can see the deep fascia of the popliteal fossa. And the next image, you can see the boundaries of the popliteal fossa. In the center, you can see the content of the popliteal fossa. And the third image, you can see the deep section of the popliteal fossa, which reveals the floor structures. So the floor is also called as anterior wall because all this contents and boundaries are visualized from the anterior aspect. So the roof is also called as posterior wall. The floor is also called as anterior wall. Now we will see each content in detail. First we will see the roof or posterior wall of the popliteal fossa. Like any other part of your body, the popliteal fossa is covered by skin, and beneath the skin you have the superficial fascia. Usually the superficial fascia contains superficial veins as well as cutaneous nerves. Here the superficial vein present in the popliteal region is small saphenous vein. This you can see the small saphenous vein present here, and other contents are cutaneous nerves from medial to lateral. So this is a medial aspect of the back of the knee joint. So you can see the medial cutaneous nerve of thigh, which is not piercing exactly the roof of the popliteal fossa. Around the midline, in the middle of the fossa, it is pierced by posterior cutaneous nerve of thigh, and laterally it is pierced by sural communicating nerve, which is a branch of common peroneal nerve. So once you remove the superficial fascia and adipocytes along with that, you can see the deep fascia, which is seen as a white layer here in this picture. So the deep fascia here is also called as popliteal fossa. So the peculiarity of this deep fascia is it does not allow the expansion of this fossa. Because of this, any lesion or swelling within the popliteal fossa tends to expand superiorly or inferiorly. Coming to the floor or anterior walls of popliteal fossa, from above downwards it is formed by, this is a popliteal surface of the femur on the posterior aspect just above the condyle, and in the middle it is formed by the capsule of the knee joint. In the middle it is thickening of the capsule known as oblique popliteal ligament, and lower down you can see the popliteal fascia covering the popliteus muscle. So there are three structures forming the floor of the popliteal fossa. From above downwards, first one is the popliteal surface of femur on the posterior aspect, and the second one is the capsule of knee joint along with the oblique popliteal ligament, and third one is the popliteal fascia covering the popliteus muscle. This popliteus muscle takes origin from the lateral condyle of the femur and inserted on the posterior aspect of the tibia just above the soleal line. So coming to the boundaries of popliteal fossa, so this is the posterior view of the right knee joint. So you can see this is a medial aspect and this is a lateral aspect. This is a medial and this is a lateral aspect. On the medially, since the popliteal fossa is rhomboid shape or diamond shape, here the boundaries are sloping in nature. So, this is the muscle forming the supromedial boundary. So, this half of the muscle is tendinous in course, that is why it is called semitendinosus. Semitendinosus muscle, and this muscle is lying over the another muscle, that is a semimembranosus. Semimembranosus. These two muscles forms a supromedial boundary of the popliteal fossa. On the suprolateral aspect, there is only one muscle forming the boundary, that is the biceps femoris. On the inferior aspect, infromedially, this is a muscle forming the boundary, that is called medial head of gastrocnemius. So, on the lateral aspect, infrolateral boundary is formed by two muscles. This is a lateral head of gastrocnemius and just above this you can see the small muscle here, that is a plantaris muscle. So, these are the muscle forming the boundary of popliteal fossa. Because of this rhomboidal in shape, the boundaries are sloping in nature. Above it is formed by two muscles on the supromedial aspect, supralaterally one muscle and infromedially one muscle, medial head of gastrocnemius. On the infrolateral aspect, two muscles, namely plantaris and lateral head of gastrocnemius.